everyone, my name is Lydia Anja. I am a climate justice advocate, and today I have joined Stowisha Initiative right at the heart of Siaya County to mark World Menstrual Hygiene Day. This is a conversation about education, health, safety, and rights of all women and girls. This is where we ensure no one is left behind, and for that, we have an amazing guest for you right here with us. So, welcome. Tell us who you are, what you do, and why is this day important to you.
Thank you. I'm Pamela Josephine Anyango. I coordinate reproductive health services within Siaya County. I work with the Department of Health. This day is important to us because during this day, we give education to the community. We create more awareness on what menstrual hygiene is. This will also entail both the various products that are there in the market and the proper waste disposal for this particular product.
Wow, this is not just about accessing products, but also ensuring they're disposed safely. I am very keen on waste management. And so maybe you could take us through some of the government initiatives or policies that are there in terms of access to services. Yeah.
Thank you. So for the government policies that we have, like in Siaya County, we have the AYP action plan that was...
Let me just interrupt you. What is the AYP?
Thank you. The Adolescent and Young People Action Plan. This is a document that was developed by the young people who are only giving technical assistance. So with the young people that were there in the room, they gave us what they wanted to be done. Because many a times the youths have been asking, why us without us?
Yeah.
So they were on the table and they were giving the ideas that they want to be covered. And in this particular document, for Siaya, it will run for 5 years. That was from 2025 to 2030. We call it AYP Action Plan. So in the document, we were focusing on a number of things. And what we focused on was the triple threat plus. When I talk about triple threat plus, we all know that from the statistics of the DHIS 2022, HIV infection among the young people was quite high. So the document is talking about the new HIV infections, how we can avert that. It's also talking about how to prevent teenage pregnancies. We all know from the KDHS again, here as a county we were at 21%, while nationally we were at 15%. So the other triple that we talk about is the GBV cases. How can the adolescent and young people report these cases? Then when we include the plus, the other plus, we have things like drugs and substance abuse among the adolescents and young people.
Oh,
yes.
Well, that is very comprehensive. So as the youth, we always say, if you're not at the table, then definitely you're on the menu. And I'm so glad that you involved the youth during the conceptualization of the AYP. And now when we talk about implementation and we're talking about access to youth-friendly services, do we also see the youth taking up those roles in ensuring that the services reach their fellow youth and even the wider community?
Thank you. Yes, with that implementation, we have within the county, we have the Youth Advisory Body. And within the Youth Advisory Body, which is known as YACH in short, we have champions from different sub-counties across the entire county. So these youths, they are a link between us and the youth in the community. And through this, we've seen a number of adolescents and young people coming to get services across our facilities.
Wow.
Because within the county, we only have one standalone youth center, which is the Bondo Wellness Center. But currently, within the government setup, we are encouraging integration of services.
Yeah.
So across all the 175 public facilities and the private facilities, we are encouraging integration of the services where when the youths come, and the adolescents and the youths come, they are able to get the friendly services within those setups.
Wow. A one-stop center for all the services. And you have also mentioned an opportunity there for the youth in Siaya County. How do they get to join the Youth Advisory Board?
So for them to join the Youth Advisory Board, we have champions across the 6 sub-counties. So they are enrolled with this the youth champions from those sub-counties. And with this setup, we also have it up to the ward level. Instead, we have the 30 wards. So we have at least a representative from each ward that can speak on behalf of the other youth from those wards. Yeah.
Wow, decentralization of it. That is really amazing. And I have a question, because now I'm seeing a lot of advocacy that they are doing. Now, when it comes to having a conversation with the elders or even their parents in the community about this critical topic of sexual reproductive health and rights, this is a very sensitive conversation when we look at it from an Afrocentric perspective, culturing in the cultural norms around it. So, how is that in Siaya County?
So in Siaya County, we've been having engagement with the youth. We've also been having engagement with the parents. Then occasionally, maybe in a quarter, we plan for intergenerational dialogues. And why do we do this? We do this because this is important. Because for the elderly people, there is the way they reason. And for the young people, the Gen Zs currently, there is the way they reason. And if a parent tells them to do something, they'll say that this is not how it is done in the current age. So when we have the intergenerational dialogue, this helps the elderly people also understand the young people, and the young people also to understand the perspective that the elderly people also, the way they view things. Yeah.
Wow. I think that is where we get to bridge policy and action. That is how we get to include everyone in the conversation and ensure that everyone accesses these critical services, because when it comes to health, it's a concern for the community and definitely for everyone. What are other challenges when it comes to SRHR in Siaya? Because you mentioned that there are increasing HIV infections.
Thank you. So that was according to the KDHS 2022. So the other challenges that we have maybe with this cohort, the adolescents and the young people, some of them wait and come to the facilities when it's a bit too late. For instance, just an example, if a girl has been defiled in the community or even raped in the community, we advocate that the girl should come to the facility immediately. If they delay, this will mean that the interventions that we should give to this young person, we will miss them because we have timings that we should give. Like, for example, if it is preventing the unwanted pregnancy, there is a period that we should give we should do the interventions. Same to preventing new HIV infections. There is a period that we should give the interventions. So if they delay, in some quarters, people still delay. And in some quarters, they also still look at maybe having the kangaroo court. So with the kangaroo court, this means now that maybe this is a child to my cousin or what. Then they want to sort those things at the community level. But in the document that I just talked about, the AYP action plan, it is well outlined that this cohort should report immediately to the facility. And it's also a multi-sectoral approach. It is not just that the community and health alone. We have education in there and they participated. We have gender and affirmative action, they participated. We have the national government. So meaning for us to work with the youth and the adolescents within the county, we give it a collaborative approach. Because at times they are in school, maybe when they are sick, they are in the hospital, or they are in the community. So if we have these combined efforts, we believe that we'll have great future leaders in future within Siaya County.
So that is quite a great vision for Siaya County. And the issue of underreporting was very eye-opening to me when you're talking about defilement, because we're seeing other layers of shame and stigma there, even for the girls and even for the mothers or the parents who feel like, I didn't do enough to protect my child. I wasn't there to protect my child. Perhaps if I could have done this or that, my child could not have undergone through such a traumatizing ordeal. And if we're talking also about menstrual hygiene, access to sanitary products like pads, tampons, how is it for the girls in Siaya County?
Thank you. So for within the county, we are working with various organizations. And with this, through these various organizations and even through the elected leaders, some of them make budgets even within the department to ensure that we have a few sanitary towels that can be shared to the very vulnerable ones. But to those that can afford, they are given the education on what to do, what products to get, how to pick and how to use them, and how best to dispose them off within the community.
And what about the government initiative of ensuring that sanitary towels are distributed in schools? Most of the time, we see this challenge of they are distributed, but they are not enough. They are limited to maybe 7 sanitary towels in a year for a girl. So, what are some of the interventions around that?
So the interventions around that is now maybe the team spirit that we've taken in Siaya County, where we work with the CBOs. We also work with the MOE. We closely work with we work closely with the Ministry of Health, such that we get to know that if funds have been issued to a particular school, and even with the local leaders. Like this year, we have a number of local leaders that have just planned to get sanitary towels to maybe schools, to schools that they within their areas where they take the leadership roles. So we believe that that is also a plan to cushion the very few that can be provided through the government system.
Wow. It's all about collaborations and partnerships. I'm hearing as she talks of Ubuntu spirit. I am because we are. If a girl is empowered, then the whole community is empowered. And as Africans, we usually say that it takes a village to raise a child. And clearly, Siaya is joining all hands together to raise, our girls in Siaya County. And maybe you could also tell me, because we are aware of period poverty and how low economic capacity can hinder a girl from accessing this product. Are there any economic empowerment initiatives that are there to support women so that they can be able even to afford this product?
Thank you. So for the bit of economic empowerment, what we've been doing within the county is through maybe the local organizations, we've been having empowering projects with various organizations where girls, maybe if they're out of school, they can be taken through to do maybe hairdressing or tailoring or something. Through that, they can be able now to buy the products by themselves. Other initiatives, maybe through the government, we now have the Nyota project, and we work closely with the Department of Gender. So through that, the young people will also be empowered. And as a result, they'll be able to pick this project. And before we even move to the government project, as a county, we believe in once the girls in their groups in the community, the support groups within the community, they have been empowered. They've been given some cash maybe to start some small business. Through that business, maybe if it is making soap or any other thing, maybe the mats, the doormats or anything, they can empower themselves, and that will be an income generating activity to that particular group. And through that, they'll continue learning the skill and even share it with other girls, and they'll be able to afford the sanitary towel.
I really think that we should all come to Siaya County for benchmarking. These are really great initiatives that you're having out here. And what would your message be to that youth out there, that girl out there who needs the motivation, who probably, had dropped out of school because of chronic absenteeism? What would your encouragement message be?
My encouragement to the young people out there, one, we are looking at you to take the leadership roles. Like number one, for instance, if I'm coordinating the reproductive health, I'm looking for somebody who will pick it up from me. And you'll not just pick it up if you're in the community, you must work hard. So if you missed maybe some point in life, you can still recollect and become a better person. So we believe that through this, if you are focused as a young person, if you are focused as a girl child, then we are very sure that you will be a leader in the future. You will be in a position of putting something or even making things to earn some income to put some food on the table. So we have a promising generation, And I want to encourage all the young people that work hard and work smart.
Yeah.
Yes.
Yeah. Every moment, every minute is a time to restart again, and every defeat is psychological until death. Thank you for those remarks. And just a quick fire question for you, Pamela.
Yes.
If you received a wild funding, what would you do with that money? Which is one critical service that you would improve?
Mm-hmm. Sorry for that. To improve that, one, what is right in my mind is to empower the adolescents and young people.
Yeah.
If they are empowered, they'll know when, they'll have the skills when to say yes and when to say no. If they're empowered, they'll know that if I do 1 or 2, 3, this will benefit me as an individual, and it will benefit my family before it even benefits the entire community and the nation.
Thank you so much for that. And with that answer, it was very forward looking, because when you empower the current generation, you have already invested in the future. That was all from us today, but be sure to follow our pages, Tawisha Initiative, for more informative, educative, and inspiring content. Thank you, and see you again.
From silence to advocacy, a generation is rising.